everyone. I am Natalie Kunzman, MD, and today you are going to get to know your mitochondria. We all have these, but what are they? Well, they are these tiny organelles that are within a cell that make the energy for us. Now, an organelle is a specialized structure within that cell that might have a specific purpose. And the mitochondria's specific purpose is to make the energy in our cells. Now, I've talked to so many patients in the past several years about their lack of energy, but in particular, especially where COVID and long haul is considered, mitochondria seem to be at least at a portion of the epicenter of this problem. So some people may have very specific reasons for their fatigue and tiredness that are very explainable with a low thyroid or high sugars, lack of sleep, or poorly functioning adrenal glands, just to name a few things. But many patients that I see have low cellular energy. In other words, not enough energy being manufactured by these mitochondria to keep the cells energetically functioning. So again, most of the cells in our body have mitochondria, for the exception of red blood cells. Now, red blood cells are just carrying around oxygen, so they don't have mitochondria. But those cells that need or use the most energy have the most mitochondria, or these battery packs within the cells. So the heart muscle is quite high and probably has the most, with 40% of its cytoplasm having these mitochondria. So that might be up to 5,000 mitochondria per cell. Now, a liver cell might have about 2,000 mitochondria in the cell, and a usual cell has about 100 to 150 of these little battery packs within that cell. So the structure of the mitochondria, it can be as complex or as simple as we want to, so we'll keep it simple. It has an outer membrane and an inner membrane, and then there is a matrix sandwiched between the two of them, and in that matrix is where that process will take place to create ATP, which is the currency of energy that we make. And again, most of our DNA is in our cell nucleus. However, mitochondria have their own DNA found within that structure, and this is similar to the makeup of a bacteria. Now, moms give us all of our mitochondrial DNA, so you owe all of your energy in that mitochondria to dear old mom. Now, this DNA is different than that found in the nucleus and doesn't encode for nearly as many proteins that we find in your nucleus. We've also found out that the mitochondria can shuttle from cell to cell by tubules. So let's just say if any of these mitochondria stopped working, you would be starved of energy. And there are a few other functions of the mitochondria that are much less known, and there are some interesting factoids about them. So mitochondria are also in charge of something that's called apoptosis. Apoptosis will program some cell death in a damaged or cell that is way too old. We want this to happen, especially with a cancerous cell. Now, mitochondria can also help produce heat, and it does so the best in brown fat. Mitochondria can also store calcium, so mitochondria does have a role, or I should say do have a role, in maintaining calcium homeostasis. So mitochondrial loss can come from some significant factors, including viruses, parasites, heavy metals, medications, and severe oxidative stress. And oxidative stress can come from the organic pollutants, DDT, PCBs, and dioxins. Now, we want to think about that home environment that you have and think about the chemicals that you might be using in your garden, your cleaning products, your skincare, deodorant, toothpaste, makeup, air fresheners, flame retardants. Some of those chemicals can disrupt mitochondria. Molds and the toxins that they secrete, called mycotoxins, can also be a significant disruptor of mitochondria. EMF exposures. We have documented that EMF can alter how these channels and voltage-gated calcium channels work, and then in that regard can cause a lot of free radical production and disrupt some of the antioxidant and the glutathione that is needed to keep our Krebs cycle and our mitochondria healthy. And some of this EMF pollution can come via screens, smartphones, computers, bright white LED lights, and it can disrupt the normal sleep cycle doing that. Now, we've got dental practices that also can disrupt our mitochondria, such as amalgam fillings with mercury, dental implants, and some root canals. Surgical implants, such as the breast implants and titanium hips, also have that potential to leak into the system and disrupt our mitochondria. Now, there are some conditions that many of you would never have suspected that mitochondria is at the root of its problem. Again, down at the cellular level is the problem. We are proposing that Parkinsonism, Alzheimer's disease, bipolar disorder, schizophrenia, chronic fatigue syndrome, Huntington's disease, diabetes, and autism. Now, I also will propose in this chronic fatigue syndrome that we are adding some of that long haul COVID to mitochondrial dysfunction. So, of course, we're going to want to know how we can keep our mitochondria healthy. How do we keep these battery packs charged in our cells? The first thing is restricting calories. So if we stop eating quite so much and restricting our calories, we have improved electron transport and production that goes through the mitochondria. Improving sleep, exercise. Now, muscle cells are also some of those cells that require lots of energy for them to work. And the more you use them, the more mitochondrial enzymes are being produced, and that respiratory capacity of the muscles is increasing, which can help take some of that oxygen and glucose and make ATP in the nutrients to power that muscle contraction. And the more you do that, the more you keep those battery packs charged. And I view this very similarly to the battery in a car. The more you keep the car going, the more you keep that battery charging. And if you leave your car sit for a year, you may come to a dead battery. Now, mitochondrial food is important to keep mitochondrial health. Now, mitochondrial food may come in the form of B vitamins, minerals such as zinc, polyphenols, and some nutrients such as L-carnitine, alpha-lipoic acid, CoQ10, pyrroloquinone, quinone, and creatinine, as well as D-ribose. Now, why are these important? These are important cofactors for the Krebs cycle, which is that citric acid cycle that occurs within the mitochondria to generate that currency, which is the ATP for our energy. We need fuel for that situation to happen. Lowering stress will help our mitochondria. Also, getting some sunlight as it's contributing to some vitamin D. And then don't forget, red and near infrared light helps with our mitochondria because it can stimulate a molecule called cytochrome C oxidase, and that's also within the Krebs cycle. Cold exposure. And cold exposure can increase brown fat, and increased brown fat has more mitochondria. Now, heat exposure for short adaptive periods of time is also helpful, as well as stimulation of NAD, which is derived from B3 and niacin, again, cellular food, to help with increasing the mitochondria. So I hope you enjoyed your introduction to mitochondria. We all have them. We need to keep them healthy. This may be at the root or the foundational issue for some of your fatigue and tiredness and brain fog and symptoms that you don't feel as though you are optimized. Again, you want to get to the root cause to figure out why those mitochondria may be dysfunctioning, and there are very specific tests that can get to the root of the problem if you see a functional physician such as myself. I'm Natalie Kunzman, MD. Subscribe to my channel below, and until we meet again, be well